We're pleased to welcome back Dr. Bursey. Thank you again for taking the time to speak with us today.
Luke, I'm real glad to be back. I really enjoyed our last talk, and I'm happy to come back and speak with you a little bit more about how we're using some ultrasound applications here at Augusta University.
So last time we chatted about the advantages of point-of-care ultrasound and the differences between tablet-based, cart-based systems, and also how your ultrasound strategies have looked with regard to COVID-19. Today, I'd like to explore with you the topic of tele-ultrasound and how that might fit into your telehealth strategy today and into the future. How are you and your team thinking about tele-ultrasound today?
So there's a couple of different ways that we're using tele-ultrasound, which is very much a new kind of concept, I think. But it's very timely because of COVID. As an example, we are a tertiary referral center and typically would take patients from multiple smaller outlying hospitals when a patient might exceed their limits, which we're seeing a lot of with COVID. A lot of these patients are requiring advanced respiratory support, et cetera. And usually those patients might just be transferred directly to us. Unfortunately, we've been very full lately, as have many places. The ICU census is full, the floor census is full, and the ADs are tending to stay backed up. So the smaller hospitals don't really have the same options to transfer patients that they have historically. So we've established a telemedicine program to help those institutions take care of their patients where they're at without necessarily having to transfer them. And telemedicine is exciting and interesting, but can also be a little bit challenging because you can see the patient, but you can't interact with them in the same way that we normally would as a physician. But teleultrasound helps change that a little bit because ultrasound probe in the hands of someone who isn't even necessarily trained in ultrasound, with direction from someone on the other end of the line who is trained in ultrasound, can give me a lot of that same information that I might be able to get if I were standing at the bedside. So teleultrasound has an evolving, but I feel like very important role in our own telemedicine program as it develops. So Luke, I'd love to give you a couple of examples of how we're actually using that in our practice now at Augusta University. So the first is actually within the hospital. We have a robust ultrasound training program, but unfortunately, much of the academic side has been impacted by COVID and created a lot of limitations in getting students and learners and fellows to the bedside to learn and to take care of patients. So this is even more difficult with ultrasound in particular because we usually would have a group of learners go to the bedside to perform an ultrasound as a group. So we do ultrasound rounds. But with the prevalence of COVID and the scarcity of PPE, it's difficult to try and get large groups of learners to the bedside, even in non-COVID patients sometimes. So one of the solutions that we've come up with has been using the React platform on the Lumify system to continue our ultrasound rounds, where one individual, maybe the resident or the fellow who's taking care of the patient, goes into the room using no more PPE than we might otherwise to perform an ultrasound while the rest of us can look on in real time and get the same sort of interaction and feedback, even if we're just standing outside the room. And that's what's pictured here in this photo. This is one of our ultrasound fellows in a COVID patient's room performing an echo with me just outside, being able to provide some of that feedback and education, almost as though we were in the pre-COVID era. Another way that we're using the React platform and tele-ultrasound is with remote academics. This is an exciting new area where we may be able to have ultrasound fellows that are geographically located elsewhere rather than having to be on the Augusta University campus. And we actually have our first one of those this year. We have a fellow who's located in an adjacent state, but will dial in with us via React to perform, his scans and ultrasounds, and we can provide that feedback and, do the teaching in real time. So not only does it work within the hospital, inside and outside of the room, but it's working for us very well across state lines. For some time, we have had a international ultrasound program. where we would go to various countries, Panama, Peru, done some work in Belize, to try and teach physicians in those countries about the use of point of care ultrasound, because often there are limitations in those environments on more advanced imaging, and the addition of ultrasound can really be beneficial in the right hands. COVID, of course, has impacted our ability to travel internationally and continue those programs. So we're exploring the possibilities of using Reacts and the Lumify system to continue some of those international ultrasound teaching outreach efforts, despite the setbacks that we're experiencing from COVID. Here are just a couple of pictures of examples of how we're using those systems. When we're actually able to travel, the tablet-based systems are great because they're small and they pack in a suitcase and they're easy to transport, and you can take a number of them all at once, so we can teach large groups. Here on the left is an example of one of our interventional radiologists teaching ultrasound guided central line placement in Belize. This is a small kind of critical access hospital that had an ultrasound available, but nobody knew how to use it. And they're still doing all of their lines by landmark technique. And so we were able to really contribute to them by showing them how to use the equipment that they had and increase the safety of their putting in lines in their patients. And then here on the right is just an example of our using the Lumify system in Panama in one of their ICUs and teaching residents and learners about point of care ultrasound. And the wave of the future for us, depending on COVID, is going to definitely involve some additional tele-reacts-based ultrasound training with these groups. And then this kind of brings me back to what I was talking about a few minutes ago, is our telemedicine efforts here just within the state of Georgia, trying to help our rural hospitals keep their patients where they're at, because there really aren't a lot of options to transfer them. So we have a fairly robust telemedicine program with multiple hospitals, and it's a cart-based system that you can see here in this picture on the left. They have a cart and we have a cart, and the tablet just plugs right into that cart and via screen share transmits the images in real time. So this isn't even using the React system, which is fantastic. But this puts the images up on the cart, in real time, and is just a different way to use ultrasound in a telemedicine platform. You can see, in this picture, one of my colleagues, Dr. Lyon here, and another, Dr. Dement, are helping to perform an ultrasound remotely from elsewhere within the state. So all very interesting possibilities, and very exciting to try and develop some of this stuff as we're faced with these new challenges with COVID. We just can't do things the way that we have always done them anymore.
Really, really fascinating stuff, Dr. Bursey. It's cool to see how you're using that technology. You guys have been faced with quite the obstacles this year, let alone any other year where you're dealing with some of these obstacles, but especially this year. And so it's really interesting to see how you're employing these technologies that we've developed and other companies have developed to overcome those barriers. Really exciting stuff. How do you
Yeah.
see this playing out into the future? So this is kind of where we're at today, and some of the obstacles you're facing today. What does tomorrow look like? What does 5 years from now look like with regard to telemedicine and teleultrasound?
Well, I'll tell you, I think that in many ways the face of medicine is going to change and evolve because of COVID. I think that things will probably always be a little bit different. Even when we get back to more towards normal, it'll be a new normal, not the normal that we knew in 2019. And I feel like telemedicine, teleultrasound, and point of care ultrasound are going to have a very well established role there. To me, and at our institution, the benefits of point of care ultrasound and tablet based ultrasound and teleultrasound are all becoming very, very clear. And I think that those things will become so integrated into our practice because of COVID that we'll just continue to realize the advantages after COVID settles out, hopefully, and we'll continue to use them to the advantage of our patients, regardless of what happens in the future.
Dr. Bursey, it is really exciting to hear how you're employing these technologies to overcome the challenges that you're facing today. It's inspiring to us as Philips, knowing that you're able to use these technologies to provide better care. And I'm sure it'll be inspiring to other clinicians out there who are trying to do the same thing. So thank you for what you do. And again, thank you so much for taking the time with us today.
Absolutely, Luke. I really appreciate the opportunity to speak with you again. Obviously, very passionate about the use of ultrasound, and I appreciate the chance to share our experiences with you.